Welcome to Science with a Twist, a podcast for curious people who enjoy exploring how science impacts our daily lives. From technology that helps the fight against COVID-19 to solutions that help clean the water we drink, it's all thanks to science. In each episode, members of Thermo Fisher Scientific's team talk to experts who are on the cutting edge of redefining how we exist. Let's get started.
Hello and welcome to another episode of Science with a Twist. I'm Ron O'Brien, and this episode is brought to you by Thermo Fisher Scientific, the world leader in serving science. As we enter into year 3 of the global coronavirus pandemic, new technology to help fight the virus is becoming increasingly important. Today, we will sit down with Miguel Faustino and Michelle Jensen to talk about a new technology that can identify the presence of SARS-CoV-2 in the air, in indoor spaces, specifically in schools. Our first guest is Miguel Faustino, president of the chemical analysis business here at Thermo Fisher Scientific. Miguel, thanks for joining me today.
Hi, Ron. So happy to be here.
To give our audience some background on yourself, can you tell us about your role at Thermo Fisher?
Absolutely. So as the president of the chemical analysis division, I'm responsible for the development of and go-to-market for a really wide range of products and services, serving segments from biopharmaceuticals all the way through industrials, metals and mining, and many other segments in between. And one of our recent innovations that we're just incredibly proud of is the AerosolSense solution, which we're here to discuss today.
I know that Thermo Fisher has been incredibly involved in the response to the pandemic over the last few years. Can you talk a little bit about the role that the company has had?
Yes, absolutely. So I've been with Thermo Fisher Scientific for going on about 9 years now. And the last couple have definitely been my most proud. And that's simply because in partnering with governments and scientists around the world, we've been able to bring to bear some solutions which are really playing a pivotal role in helping to keep us all safe, ranging from development of one of the first PCR tests available to working with pharmaceutical companies to bring vaccines to the world. We've really been at the forefront and really playing a significant role.
We've all become accustomed to telling each other to be safe, stay safe, and there are several risk mitigation tools that are being used during the pandemic that we hear about on the news regularly. You know, whether that's COVID tests, masks, vaccines, hand washings. But I understand that you have a new technology that's helping to detect in-air presence of the COVID pathogen. Can you tell us a little bit about that?
That's right, Ron. So if there's one thing we've learned is that there's no one single solution that's going to be deployed that ensures our safety, right? So the AerosolSense solution, when paired with PCR analysis, can be used to detect and identify the presence of coronavirus in the air around us, which is incredibly powerful when complemented by those other tools that are currently available to us today that you just mentioned.
What exactly is an in-air pathogen monitoring solution?
So essentially the way it works is that our tool, the AerosolSense unit, draws air in from the room that it's been stationed inside of, and it can be deployed virtually anywhere with an outlet. It'll run for 2 to 12 hours. That's what we would typically recommend. It'll create a sample, which is then analyzed via PCR, just as you would analyze a sample for an individual looking to determine whether or not they are infected with coronavirus.
So an in-air pathogen monitoring solution can help provide an additional level of surveillance. Talk a little bit about how that works in the type of environments in which it works well.
Absolutely. So if you're put yourself in the shoes of a decision maker in a school, or perhaps it's just at an office or a government building, you're constantly seeking ways to help guide your safety protocols that you've enacted, whether it's wearing a mask, whether it's social distancing, or some form of an asymptomatic testing program. You want to be able to make those decisions based on data. And environmental surveillance using the AerosolSense technology gives you data telling you whether or not, with a high degree of confidence, coronavirus's presence in the air around you, which you can imagine is just so incredibly powerful for these decision makers who are making just such important decisions every day that are required in order to keep us all as safe as possible.
I think it's fair to say that there are other in-air pathogens. Does the AerosolSense Sampler detect those as well?
It does, and it's not limited to coronavirus. So flu A/B can also be picked up in the sample and analyzed via PCR, as well as RSV.
Can you talk about the type of environments where the AerosolSense Sampler has been placed?
Absolutely. So this solution was designed really to be scaled and deployed just really anywhere inside a space that you have an interest. So you could imagine schools, nursing homes, universities, and even the workplace. We use it right here where I'm based out of, are all places where you would have an interest in knowing whether or not coronavirus is present in the air around you.
And what do we do with the information or the data that's generated by the AerosolSense Sampler? How do we use that?
So the way the data is ultimately used is up to the decision maker for these facilities, but there are a number of ways that it's being used to help guide safety protocols, as well as the duration of those safety protocols, for example. But it's really just provides a wealth of potentially near real-time data when used in conjunction with our Renvo solution, which is about to be launched and offers on-premises gold standard PCR analysis within just 30 minutes of taking the sample.
So Miguel, how does the AerosolSense Sampler work?
Yeah, so the AerosolSense unit arrives. You take it out of the box and you plug it in. For those of you who are viewing, it's right here over my shoulder. For those who are just listening, it's about the size of a toaster oven with a small stack on top of it. So once it's plugged in and you've inserted the cartridge, you turn it on, and this stack draws air inside of it, and a sample is collected in a substrate inside of the cartridge. So once you've run it for your desired time frame, and we recommend anywhere from 2 to 12 hours, you then can take that sample and have it analyzed via PCR. So it's a highly transportable system, easy to use, easy to operate, and it gives you highly reliable data in a flexible environment such that you can dictate how long you actually run it for. So Ron, in terms of ease of use, it passed the ultimate test, which is I'm able to use it. So all you have to do is plug it in, insert a cartridge, turn it on, and it just runs. Right. So if you choose to run it for a shorter interval, because that's your time of interest, could be during a particular class, as an example, for a couple of hours, up to 12 hours would be our recommendation. It's really up to the user to determine. When it comes time to remove the sample, you simply just power it down, remove the cartridge, and the preparation steps to have it analyzed via PCR is as easy as can be.
I understand that PCR is the preferred method of being able to detect the virus at very early stages. You mentioned a rapid PCR test, Renvo, I believe you called it. Can you talk a little bit about Renvo and how it's been incorporated into the AerosolSense Sampler?
Yeah. So when we first launched AerosolSense, you had to take that sample and typically send it to some central lab where it would be analyzed via PCR. But with the introduction of the Renvo rapid PCR solution, it allows us to actually bring it to the space, the same space in which the AerosolSense unit is placed, to be able to offer an answer as to whether or not coronavirus is present within about 30 minutes. Equally as important is that the sample transfer and preparation is very safe, because it's intended to be used by virtually anyone who has the ability to follow our very brave video-based training program, and to do so in a way where they are not themselves put at significant risk of contracting the virus in doing so. So it gives you information much sooner in a highly accurate and safe way that just further bolsters the power of the data that can be derived from the solution.
Wow, that's quite an improvement. Not having to send the sample out to a lab means that I could have the results in virtually 30 minutes?
Correct. And that's why we're so excited about it. You can imagine just how much more you can do with the information when within 30 minutes if, in fact, coronavirus is present in the air around you versus potentially having to wait 24 or even 48 hours. So far more actionable data is now enabled.
Okay. So, Miguel, why is this technology so important for schools and other facilities to adopt?
Like as a parent, like so many of us, sending your kids to school to every day can come with a certain level of angst in this environment, right? Because it's just an uncomfortable feeling. And so, when I think about the way that this technology can be used to determine whether or not coronavirus is present in our classrooms or cafeterias, I can rest assured that those decision makers have all the data available to them to make the best decisions on behalf of our children. And that's why I really just appreciate so much what the Deerfield School District has done in being an early adopter of the technology, demonstrating its power and using it to help keep children as safe as possible in a classroom environment. Of course, it's not limited to the classroom. There's so many other environments, such as nursing homes and airports, where I can imagine a solution like this being so incredibly powerful. But certainly, that's one that's top of mind for me.
So, now that we understand what the AerosolSense Sampler is, we want to sit down with Michelle Jensen, Superintendent of the Deerfield Community School District in Wisconsin. The Deerfield School District is using the AerosolSense Sampler at their schools to help facilitate back-to-school safety. Hi, I'm Ron O'Brien, and I'm welcoming Michelle Jensen, who is the Superintendent of the Deerfield Community School District in Wisconsin. Michelle, thank you for joining us.
You're welcome. It's really great to be here.
So we were talking earlier with Miguel Faustino about the AerosolSense Sampler, and Miguel told us that he had a customer in Wisconsin who's been using the AerosolSense Sampler for a while, and that it would be great if we could speak to you. So talk to us a little bit about how you found out about the AerosolSense Sampler.
Sure. So I live in Dane County. Deerfield is a small community just about 15 minutes east of Madison, which is the state capital. And it also is home to the University of Wisconsin-Madison. And so, in one of our Dane County superintendent phone calls that we've been holding actually weekly since the pandemic started, professors, doctors David and Shelby O'Connor from the UW Madison science team were on those calls as a guest. And they actually brought forward the idea of a Thermo Fisher AerosolSense sampler in schools. And they had already paired with Thermo Fisher on this pilot project, but were asking if any school superintendents on the call might be interested in entertaining using the machines within their school districts because Thermo Fisher had already used the air samplers in a number of other industries, but we're looking for a K-12 setting or some K-12 settings to see how it might be useful in schools. And so as soon as that call was done, probably before it was done, I was emailing David and Shelby O'Connor saying, count me in, let me know what more this is about because I want it in our school.
That's great. Talk a little bit about the process. I know that when we spoke to Miguel, he explained to us what it was like taking it out of the box and plugging it in and starting it working. For you, it must have been a little bit more, of a challenge to actually get the device in the school and then, set it up and get it working. You want to talk a little bit about that?
They kind of described it because we were all trying to figure out like what is the size of this, what is it going to take up, and what do we need to use this and make it workable. And they said, well, it's about the size of a toaster oven. So they were giving us this comparison, and then they took us actually on a trip. It was another school district and myself that were on FaceTime with them, and they showed us what it was looking like at an actual school. And I thought, oh, I can handle that. So of course the boxes come, and we were fascinated to see exactly what this machine looks like. So anyway, it's about the size of a toaster oven. I would say I agree with that. And we simply just placed them on desks and in the locations where we had the highest foot traffic. And it was very, very easy to kind of integrate them into our setting. And they're not too large that they're going to take up too much space that kids can't walk around them. These kids were very excited at both my elementary building and my middle school, high school building to see what this looked like because I had already introduced it to our school board and our public by that time.
And we talk about the AerosolSense Sampler in the context of it being complementary to some of the other methods that you're using to ensure the health and safety of your student staff and administration. What other types of surveillance or what other types of testing are you using?
So in Dane County, we do have a face covering mandate. That mandate started back before our school year started. So it came out in the end of August and it has continued on. So in our setting that we are right now, we do have to follow the county mandate. So we are universally masked at all times in our buildings, all day and night for our events. And so we already have the face mask mitigation strategy, which to us, we feel like hands down is the number one strategy we can use. We, of course, also heavily promote vaccinations for students and staff because we do believe that that is the one medically proven science that we can use in terms of trying to keep people healthy. And then just also internally, we still are using hand hygiene, really good hand hygiene, making sure that students are monitoring symptoms and staff are staying home when they're sick. And within our classrooms, we are using physical distancing to the extent possible. And likewise, during our lunch times when students are actually seated at a table, would have their masks off and be eating. We do have assigned seating areas, which we of course, are trying to have students be more physically distanced. I will tell you the challenge of that compared to the previous year, and this is why the AerosolSense Sampler for me was really a wonderful tool to add to our kind of toolbox of strategies, is that this year when students came back, we were trying to give them as normal of a school experience as possible. So while they are universally wearing face coverings, they are not able to stay apart from each other when they're in the hallways. They're not able to stay apart from each other during break times. We work really hard during the lunchtime, but if you've ever been in a school and seen hundreds of students all trying to eat at once and stand in line at the lunch service, it's really difficult to keep them physically distanced. And actually, it's not practical. Students would be lined up outside the door. So we just don't have the ability to follow all of those. And so we're always looking at to the extent possible. So, knowing that we were coming back and using those mitigation strategies to the best of our abilities, I wanted to have something that would still tell me what was happening as they were walking by. And the aerosol sense sampler was just a really easy solution. It was just super easy to put into our schools, and it just constantly is giving us a metric of what's happening, even with all of those other mitigation strategies.
The aerosol sense sampler, as you know, is intended to yield a negative result. You know, we hope for a negative result every time that we draw a sample from the machine and test it because that's an indication that there's less risk, associated with being in the building. Have you had a situation where you had a positive test result? And if so, what did you do?
We have. So this was interesting because when we started with the aerosol scent samplers, and we have been doing this since the beginning of October. And just to kind of back up, our way that we integrated this into our school district was that I paired up with our chemistry and biology teacher at the high school because I felt like this was a really great opportunity for our students at the high school level to see kind of real time living science and research as it's happening. So our students in advanced chemistry and advanced placement biology are the students that actually are responsible for putting the cartridges in and out each day. And so we had them on board. We've done some work with some scientists at Thermo Fisher who were guest speakers in our advanced chemistry class to be able to explain how it works. And so I this ties back to your question because they were very disappointed because we kept getting negative results. And so while it seems really odd and counterproductive that you have kids and even adults, myself included, who are waiting for a positive test sample, we didn't get it for days and days and days. Now, I will tell you that that really closely matched what was happening in our community. So we did not see necessarily high case numbers. And when we would see a case number, if we got a negative result, because keep in mind, all during this time, I've had positive cases in my school district. But what it also was telling us was that that student was also following our advice, and their parent was, which was please make sure you're staying home if you have any symptoms, right? Stay home as soon as those symptoms start. Make sure you go get tested. So we were able to pair a negative test result with the idea that even though we had positive students, we knew that they were not in the building typically at the time where they were carrying a viral load that would be contagious to others. So it took us a long time to get a positive result. And when I say a long time, I mean several weeks. And so, interestingly enough, we had one that showed up. We were all very excited. We asked for the CT value so our chemistry class could take a look at it and learn more about it. But then I was able to go back and look at our student illness tracker, which is actually very, very detailed. And I was able to find which student was probably attached to that positive result or which students, if there was more than one. Now, interestingly enough, as you would expect, what has happened, we've been living in a Delta variant since October. And now, just recently, Omicron has presented itself in different ways with higher transmissibility and lower timeframes. So, as would be expected, and it happened, is that since January, when we returned back from our Christmas break, we have had 4 positive cartridges. And so 2 from each building, 2 from my high school building, 2 from the elementary building. The most cases we have had by far of COVID since this began in 2020 has been actually in the last 3 weeks. And so having 4 positive cartridges, we've only had a total of 6, mind you. So we've had a total of 6 cartridges that have been positive, 6 other ones that have been inconclusive, but 4 of those 6 have literally happened in the last 3 weeks. And so again, going back and looking at our student illness tracker became kind of difficult because there are so many students that were on it at this point, but it also reinforced for us the idea that one, we know that COVID particles are present in the school to the level that the tracker is picking, or the AerosolSense Sampler is picking them up. 2, we need to make sure that everybody is really diligent about face covering. We know that they're doing a really good job, but occasionally they end up being pulled down around the nose, or sometimes they're probably not the best face covering. So it just is a reminder for us to go back to our staff, to our students. I repeat it every single board meeting. It's really important that we have good face coverings. Handing out more face coverings also helps, but yes, we have had positive cases. Yes, I do report those to the board. It doesn't necessarily cause anybody, I would say, a great scare or concern. It's more, again, like I say, it's a useful tool for us that says, here's where we're at. This is the surge. And the aerosol scent sampler is really matching what we're seeing. Now, the good news in that is that if we take a look at the last 3 weeks, for instance, and we are testing 2 days a week, in that time frame, we also have had negatives. And so when we have a positive in the same week that we have a negative, it does in fact tell me again that people are doing the strategies that we asked. Parents are remembering to keep students home that might start having symptoms and making sure to go and get tested as soon as possible. So again, we're using it to kind of gauge human behavior and knowing if there's something that's missing in that when we compare those 2 pieces of data, that then it tells me what communications I need to give out to others.
No, I think it's a great insight, as you say, into the health of the building. And the natural question would be, what has been the reaction from different constituents, whether it's the students, the staff, other teachers, the science teacher, what has been the reaction to the aerosol sense sampler in the buildings?
For us, it's been very positive. I have been very transparent in this project, this pilot project. So when we first were gaining interest in it, I shared it with my administrative team. I also shared it with the school board at the next school board meeting. So I introduced it to them at that same time and also to our staff. I wanted everybody to be fully aware of what it was doing. And so I wanted to make sure that I was in front of the messaging so they really understood how we would use it to help as another device that was giving a metric of building safety or building health. The same thing with the families. And so our students, of course, if we think about how oftentimes messaging gets home to families, it gets home through students, right? So as soon as students were a part of actually the daily work of this in terms of putting the cartridges in and out, and being able to ask questions about it. Well, that messaging right there, that curiosity, that science that goes with this really amazing tool was instantly transferred to home in a very positive way because they realized that they're also getting to be a part of, again, living real-time research. So I took the aerosol scent sampler at the high school and I moved it to our front entrance because I wanted to take a metric of the community coming by. So up to this point, we have only run the aerosol scent sampler during the school day, and that was a very deliberate choice on our part because I did not want to be measuring the health of other visitors coming into the building because I felt like that would skew what we were trying to determine in our own monitoring. So it only runs during the school day for us. So I knew we were only talking about our students and staff. So for us, that was a deliberate choice. In December, because we had this nighttime event, it was the first time that we were going to have a very large crowd of people come into our gymnasium at a time in which we were seeing a little bit of a surge up in terms of COVID going into that December time. So I decided I was going to place it at the front entrance because I knew that we would have probably about 200 to 300 adults and family members walking by. And then on top of it, I would have students who would later in that evening be performing either singing or playing an instrument. So now what we know about, again, a respiratory disease is we've got an ample time for someone who might be sick or someone's multiple people who might be sick, maybe have a viral load of COVID that is now coming to perform at this concert. And so this was a time in which there was a lot of conversation amongst schools in our county of should we even be having these types of events? Should we be having people brought together to have a whole group of, 75 students all singing at once or 75 students all playing instruments in a gymnasium just because again of the respirations that are emitted during that. So I thought, well, what better way to do this than put this in front of them? And so they all walked by it. They all knew what it was. I stood there. I waited. I asked, answered questions to them and had a couple of people who came up after the concert and said, so this is the machine we've been hearing about, and just really wanted to know how it worked and what kind of results it gave us and so forth. And so, yeah, they had a chance to see it working in action. What was really interesting is actually that ended up with being a negative cartridge. So they see it, they know it's here, and I think they just gotten used to it. Like I said, at the elementary school, they get really excited and they have names for it like COVID extractor and all kinds of stuff.
The technology, as you know, could be applied to other types of airborne pathogens, whether flu A, flu B, or some of the other respiratory viruses. Do you see an application for the school district beyond the COVID situation?
I think so. I think that one of the things that schools have struggled with in the past, and it's happened, right, where schools have ended up in an outbreak of some type of respiratory illness. And again, we're back to oftentimes it's too late, right? You end up with a child who has some symptoms and the parent calls them in, and we don't necessarily ask all those details, right? So I think that I foresee this being really helpful during especially what we know of that time frame in which we're typically seeing those types of flu-like illnesses in the winter months, at least here in Wisconsin. And this being a metric that could be helpful in predicting what's happening and what's going on, right? And I think maybe if nothing else, what we have really, really learned from this experience is that paying attention and monitoring symptoms much more closely is really an important element in trying to maintain the health and safety of a building in which literally there's hundreds of people in here every single day, right? And we haven't always done that in the past, probably real well, but maybe what it will help parents is to pay attention to those symptoms earlier and keep their child home. I've had a lot of parents who have commented with mixed emotions saying, before this, if a child had a slight cough, they would have been able to come to school, right? Well, now I think it's making us wonder, is that really a good idea? Maybe we were doing that before, but is that really what we should be doing? Or should it in fact be that when your child is starting to have a slight cough and that runny nose, maybe they're fever free, and so you've still been sending them to school, but is that really what we should be doing? Maybe in terms of, again, for just general school setting health, we really should be encouraging those families to think twice, keep that child at home for a couple of days so that, in fact, we're not infecting other people because this has really shown us in, unfortunately, a 2-year span of time now, how easily transmittable those types of illnesses are in this setting.
Yeah, the I think over the next few months and then obviously into the future years, the government, whether it be state or federal government, will be looking at ways of ensuring that they are able to keep schools open, obviously by preventing these type of widespread infections. Do you think that funding is something that we need to work on, or what do you think are the barriers to widespread adoption of the aerosol sense sampler in a school like setting?
Right now, I would say from our experience, it is funding, and I'm really hopeful that there might be an opportunity to either at the state level or the federal level that they would recognize the aerosol scent sampler as a really useful scientific based tool that school settings and maybe actually other public settings, I could see healthcare settings also finding this to be very, very useful, but for the school setting, allow the state or federal government to put this on their, I guess, their toolbox of allowances for schools. Right now, when I look at us going forward, we're very fortunate to have been a part of the pilot project and to have a team of people that I've been working with at Thermo Fisher being willing to help us continue on to a second phase of that. But I think that that until it is, able to be, I think really appropriately addressed is going to be an obstacle for schools being able to use this kind of technology. I just, we were in a situation just last week with my school nurse and myself when we were trying to again look at overall school building health, right? We were looking at the tracker and we have just met our surge and feels like we're kind of on a downswing. I think I'm crossing my fingers. Interestingly enough, this is how long we've been doing this. What is one of her questions to me? What is the AerosolSense Sampler data showing us? So this is even on her mind too, right? Like, what is the data showing us? What are the cartridges coming back? This is how we're talking about this piece of data in terms of our decision making.
I think that your application of the technology and your use of it in a real life setting is incredibly valuable to Thermo Fisher because the technology obviously was developed in a lab, but until we actually install it in a building and begin to collect those samples, we don't have actionable data. And so I want to thank you for joining us today and sharing your experience with the AerosolSense Sampler. If any of our viewers are interested in learning more about this particular surveillance or monitoring system, you can visit thermofisher.com. And again, thank you, Michelle, for joining us today.
You're welcome.
Thanks for tuning in to this episode of Science with a Twist. This show is brought to you by Thermo Fisher Scientific, the world leader in serving science. If you enjoyed this episode, then follow Science with a Twist wherever you get your favorite podcasts.